Hello, everyone. My name is Mendel Hoffer, and today I'll be presenting on suicidality and homicidality with a focus on crisis intervention and trauma-informed approaches. This presentation is part of my course, Trauma, Crisis, and Traumatic, with Dr. Peter. Suicide and homicide aren't just statistics. They represent real lives lost and communities impacted. The effects of suicide extend far beyond the individual, deeply affecting family, friends, and society as a whole. Similarly, homicidal and behavior can have devastating consequences, requiring immediate intervention, long-term support strategies. Throughout this presentation, we'll explore evidence-based strategies for preventing and responding to suicidality and homicidality. We'll discuss prevention models, crisis intervention techniques, assessment tools, mandated reporting responsibilities, and treatment approaches best suited for individuals experiencing severe distress. Recognizing the signs of suicidality and homicidality is critical for prevention. Whether we're mental health professionals, educators, first responders, or community members, we all have a role to play in identifying those at risk and ensuring they receive the proper intervention. Beyond the statistics, my goal is to highlight the human aspect of these crises and explore how we can better support those in extreme distress. Suicide prevention is a critical part of mental health intervention. While statistics give us a broad understanding, they don't fully capture the pain and complexity behind each case. In 2022, over 49,000 people died by suicide, making it one of the leading causes of death in the U.S. Men are significantly more likely to die by suicide than women, and firearms remain the most common method. So what can we do? Prevention models like the zero suicide model focus on system-wide changes in healthcare settings, ensuring that every patient is screened for suicide risk and provided with continuous care. The AMSP model, which stands for Assess, Intervene, and Monitor, takes a more individual approach, creating targeted support for those at risk. Another key prevention strategy is means restriction, which involves reducing access to lethal methods such as firearms and certain medications. Research shows that when access to lethal means is limited, the likelihood of survival increases. Community-based outreach and education also play a pivotal role. Many individuals struggling with suicidal thoughts, seek help due to stigma, don't seek help due to stigma or a lack of awareness about available resources. Ensuring that communities have easy access to crisis hotlines, counseling services, and peer support programs is essential. Training programs for educators, employers, and medical professionals further enhance early identification of at-risk individuals. The bottom line, suicide is preventable. Through risk reduction, community outreach, and evidence-based interventions, we can save lives. When someone is in crisis, time is critical. Immediate intervention can mean the difference between life and death. That's why crisis response teams at local, state, and national levels are so important. Here in Rockland County, the Behavioral Health Response Team, BHRT, provides 24/7 mobile crisis intervention. Instead of requiring individuals in distress to navigate the hospital system, BHRT comes directly to them. The National Alliance on Mental Health Illness of Rockland also offers peer support and crisis services through the 988 Suicide and Crisis Lifeline. At the state level, the New York State Office of Mental Health coordinates crisis response response resources and provides guidelines for handling disaster-related mental health crisis. The Institute for Disaster Mental Health at SUNY also trains professionals in psychological first aid, ensuring that first responders and mental health workers are equipped to handle emergencies. National resources like the SAMHSA Disaster Distress Helpline and the National Domestic Violence Hotline provide immediate crisis counseling for individuals experiencing trauma or abuse. A core principle of crisis intervention is ensuring safety and stability. Individuals in crisis may feel overwhelmed, unable to think clearly, and unable to see solutions beyond their immediate distress. Effective intervention focuses on de-escalation, creating a safe environment, and connecting individuals with long-term support. Trauma-informed approaches emphasize safety, empowerment, trust, and collaboration in the healing process. Identifying and reporting abuse and neglect is a critical responsibility for mental health professionals, educators, and other mandated reporters. Many victims, especially children, older adults, and individuals with disabilities, are unable to advocate for themselves, making professional intervention essential for their safety and well-being. Additionally, cultural considerations must be taken into account when assessing and reporting abuse. Some cultures may have different disciplinary practices or family structures, and it's important to distinguish between cultural norms and abuse behaviors. However, cultural sensitivity should never be a reason to overlook clear cases of harm. Training in cultural competency helps professionals navigate these complexities and ensure that reports are both accurate and appropriate. Assessing trauma in clients at risk of suicidality or homicidality is these are some things that you should look out for. Hypervigilance, disassociation, self-harm, or impulsivity. Now, we'll go back and we're going to go to the reporting abuse. The identifying and reporting abuse neglect is a critical. Assessing trauma in clients at risk for suicidality or homicidality. There are tools that we can use, such as assessment tools, Columbia Suicide Severity Rating, the Trauma Symptom Inventory, or the ACES, or the Common Trauma Symptoms. Identifying and reporting abuse and neglect. Identifying and reporting abuse and neglect is a critical responsibility for mental health professionals, educators, and other mandated reporters. Many victims, especially children, older adults, and individuals with disabilities, are unable to advocate for themselves, making professional intervention essential for their safety and well-being. Mandated reporting laws vary from state, but in New York, professionals who suspect child abuse or neglect must report it to the statewide central register. For elder abuse, Adult Protective Services is a primary reporting agency. Failure to report suspected abuse can have serious legal and ethical consequences, and more importantly, can leave victims at continued risk. Recognizing the signs of abuse is crucial. These are some things you should look out for. So first, we have a bunch of hotlines that you can reach out for. You have the abuse hotline services. You have child abuse hotline, National Sexual Abuse Hotline, Adult Protective Services as well, the APS. So back to now, recognizing the signs of abuse is critical. These are some things you should look out for. Physical abuse, unexplained bruises, fractures, burns, or injuries inconsistent with explanations. Emotional abuse, withdrawal, aggression, or extreme behavior changes. Sexual abuse, inappropriate sexual knowledge or behavior, sudden fear of specific individuals, or physical signs such as difficulty walking or sitting. Malnourished, neglect, poor hygiene, chronic school absence, or lack of medical care. Disclosures of abuse must be handled with sensitivity and care. Many victims fear retaliation, feel ashamed, or worry about the consequences of reporting. Research shows that survivors are more likely to share these experiences when they feel safe, supported, rather than pressured or interrogated. Now, these are some things also to look through when we're dealing with neglect. Recognizing the signs of neglect, you can see physical different things about a child or a person. You just can see that they've changed. Somebody's withdrawn to themselves, or somebody's not reaching out to family anymore. They're cutting themselves off from family. Um, so now, disclosure of abuse must be handled with sensitivity and care. Cultural factors. For individuals struggling with suicidality and homicidality, evidence-based trauma therapies provide structured, effective interventions that address both physiological and psychological responses to trauma. Responding to abuse, percentage of victims experiencing different forms of abuse. You have physical abuse is very high with 65%. Emotional abuse, you have with 85%, even higher. Sexual abuse reporting is even lower, 45%. And neglect, you have 75% of neglect. So now we're going to talk about effective trauma therapies. For individuals struggling with suicidality and homicidality, evidence-based trauma therapies provide structured, effective interventions that address both psychological and physiological response to trauma. The first we have is dialectical behavior therapy, DBT, focuses on emotional regulation, distress tolerance, and mindfulness, practically for individuals with chronic suicidality. Eye movement desensitization, de desensitization, and reprocessing, EMDR, helps process distressing memories and reduce PTSD symptoms using guided eye movement. Trauma-focused cognitive behavior therapy, TFCBT, designed for children and adolescents, combining cognitive and restructuring with exposure techniques. Somatic experience, SE, addresses the physiological aspects of trauma by helping clients regulate their nervous system and release stored tension. Each of these approaches plays a critical role in crisis intervention, helping individuals process trauma, regulate emotions, and develop healthier coping mechanisms. Now, we've created a game here to help people and support people in their suicidality. It's called the Path to Hope. It's an interactive tool designed to support individual experiencing suicidality by guiding them through structured conversations and activities that foster connection, emotional regulation, and future planning. The game is built around four key areas of resilience: emotional awareness, coping strategies, social connection, and future goals. Players can choose a specific path or randomly select prompts that encourage them to explore their emotions in a safe and supportive way. For example, an emotional awareness path, a player might describe their emotions using a weather pattern, making it easier to express complex feelings. The coping strategies path introduces grounding techniques such as deep breathing or sensory focus to help regulate distress. Social connection is a critical element in suicide prevention. Prompts in this path encourage players to reflect on their support systems and identify trusted individuals in their lives. Finally, the future goals path fosters hope and positive thinking by helping individuals envision possibilities beyond their current struggles. The goal to path the goal of Path to Hope isn't about winning in the traditional sense. It's about making progress towards stability and resilience. By engaging in structured conversations and grounding activities, individuals feel heard, supported, and empowered to seek further assistance. Crisis intervention isn't about addressing immediate risk. It's about building lasting resilience and guiding individuals towards meaningful support. And here, that's what we can talk about also. It's about community engagement. We have to have emergency preparedness education to help people collaborate through the crisis that they're going through. And we need resources for mobilization and coordination. So, to summarize, suicidality and homicidality require a comprehensive and trauma-informed approach that includes risk assessment, crisis intervention, targeted treatment. As mental health professionals, we must remain vigilant, informed, and compassionate in our approach to crisis intervention. Thank you for your time. Have a good day.